Hello and good day. My name is Dr. Neto, and I'm the co founder of Digital Health Nigeria, where we help digital health startups succeed. I'm grateful to have the opportunity to speak to you today about the Nigerian digital health landscape. Unfortunately, I couldn't be there physically, but I'm glad that technology makes it possible for me to be able to share with you some of my thoughts on the landscape and some data on what's going on in the area, and also to ultimately introduce Iqvia HCP space and talk about how it fits into the general scheme of things and what we're seeing currently in our health technology space. Um, Currently, we're all aware that digital is accelerating in Nigeria. We've got a lot of people going online using mobile phones. Internet penetration is quite high, and we have a lot of smartphones. In 2011, and we only had about 4 million, and that's increased to about 2000 to 15.5 million in 2016, and this continues to grow. What's proliferating more is even more activities on social media, Facebook, Twitter, WhatsApp. Digital is growing, and it's here to stay. There's no doubt about it. And what are people doing on their mobile phones? It turns out it's everything. This survey from some time ago revealed that it's actually not unusual for people to use their mobile phones to diagnose or treat a medical condition. 14% of people said that they do this already. What's more interesting is that in another survey, they show that 11% of people are using their mobile phones to diagnose a condition or receive treatment, and asked if they'd consider using it for any of the following in the future, 37% indicated that they would like to use their mobile phones for healthcare related instances, and it shows that there's a huge room for growth in this area. And so, are we ready to meet this demand for digital health services? Well, let's look at what the current state of the health tech environment is. This report from the UN Foundation a couple of years ago suggests that the Nigerian digital health sector is developing slowly in an emerging enabling environment. This is where they peg us at currently, that we're still developing and building up, and that we're quite a bit away from scale up and mainstreaming of health ICT. So there's quite a bit of work to be done. Thankfully, there's already some policy and technical directions that are beginning to emerge in the area. We see that there are some existing institutional initiatives in the areas of registry of health facilities, national health management information systems, etc. There is some work still to be done on areas around security and interoperability standards and other layers of services and products that will be built on top of that. Thankfully, some work is being done in the area, and let's talk about a proper policy coming into place over the next few years, which will be very exciting for the area. Having said that, looking at how health digitization has gone over the years, particularly in advanced countries, they would have started over some 40, 50 years ago in the 1960s, where they would have started to build EMRs and then moved on to early automation and then mobile health. And currently they've been in the area of sort of using AI and big data and Internet of Things to try and disrupt the way medicine and health is provided. There's a lot of talk now of artificial intelligence displacing radiologists in particular. And so they've sort of gone through that process and developed systems over the years to be able to enable them to get to this stage of using AI, etc. And that's in developed countries. Whereas in developing countries, we're still at an early phase of digitization. So we are still transitioning really from paper to digital. And there's a lot of work still to be done. The advantage, though, is that we don't have a lot of legacy systems as other places would. So it means that we can, to use the term that's often used in reference to Africa and technologies, leapfrog the developed nations. And so it's an opportunity that we can tap into. Having said that, it's important that we don't sort of start from the end, that is, put the cart before the horse. We need to go through a process where we start by digitization of health professionals. not uncommon to come across health professionals that wouldn't know how to use a mouse or wouldn't know their way around a computer. And thankfully, the proliferation of smartphones and technology is improving that. But I don't know that that's necessarily translating from the use of smartphones into actually being able to use computer-based software, which is the competency that healthcare professionals really should have in order to properly use digital health tools. And so when we get to a stage where we're able to digitize health professionals, we can then move on to actually digitizing the health centers. So things like imaging, remote patient monitoring, etc. So we would have had the professionals that can use those systems and then create the systems. And then over and beyond that, we can then start to digitize supply chain management, digitization of patient information, etc., do data analytics, and do so much more. But really, the foundation of all this is around digitizing the health professionals and the health centers in which they work. So HCP space is really key in beginning to make that whole process work, where they bring healthcare professionals together in a digital place so that they start to feel comfortable around using digital in their everyday interactions. So are there any digital health solutions in use? What are those like? So an inventory of e-health solutions in 2014 showed that there's over 100 efforts. Most of these are focused mainly in maternal, newborn and child health. And also many of these are donor funded. Looking at what health system function these play, you can see that most of them are around health information systems, communication tools, or around educating patients to help change their behavior. Looking at the country as a whole, there's quite a bit of activity all through the country, but as you can see, mostly in the urban areas is where you find a lot more activity. What stages are they at? Many of these efforts seem to have been in early stages in 2014. Many pilots there, proof of concept, etc., and then some sort of starting to scale up and go on. There was another review done in 2016 to look at the inventory and how things have progressed, but that hasn't been published yet. So it'll be interesting to see how that has gone. Looking at what type of technology they use, see that SMS is quite popular, and that makes a lot of sense. Next is that data applications, and that makes a lot of sense as well. Yeah. So having said all this, there's still a lot of barriers that exist in actually trying to get health technology to work. Top of the pile, of course, will be around infrastructure and device access. So that, as you can see, a lot of people are using database applications, and so network is often not very reliable. And you can imagine how frustrated providers would be if they try and access something online and they can't. And so that can be a challenge. And then in healthcare centers, not all of them have devices, etc. There's also barriers around funding. So if it's the government funding these, they often don't fund it appropriately, or if it's funded, they mightn't get the funds. So it's very tricky. Look at the private side, private providers may not really be particularly interested in actually putting a lot of resources into health technology. So that can be a challenge. Of course, we need a lot of policies and leadership from the government themselves. And a lot of work is being done in this area, but certainly more of it needs to be done, and it needs to be faster as well. And the human resource capacity, as I alluded to earlier on, we need to first digitize our healthcare workers even before we start to think of anything else. And so a lot of work has to be done around trying to get that working. And even when we do have them digitized, it's actually having the specific health IT skills to be able to support large-scale deployment of health IT. So a lot of barriers. But this isn't stopping a lot of startups. Over the last 4 years, a lot of startups have emerged and have done a lot of great work in this area, many of them in various stages of development and adoption. And just to give you a quick overview, this is a snapshot of the digital health landscape of some of the startups that we work with in Digital Health Nigeria. And all of these here would be really privately funded, and none of them really government funded at all. And so you see there's a lot of interest and activity in the telemedicine space. Companies like Kamkwe, who would have raised a lot of investments internationally. There's also, of course, a bit of activity in the pharma area, and companies like Sproxil and M-Pedigree will be very well known. In supplies, a great company like LifeBank that gets blood and delivers it to where it's needed. key to a lot of work that all these startups and companies are going to do is really the space that Iqvia HCP space is going to play, and that's in the networking, learning, and development. You can see how, with the growth of the HCP space of health professionals and practitioners signing up, interacting, learning, getting comfortable, you can see how that can really provide the platform for everybody else to plug into and start to really coordinate around improving healthcare provision with technology. I certainly believe that HCP space will be a turning point for a lot of the good things that will happen in health technology across Nigeria. And so we're really excited to have this great app and look forward to the many great things that will happen as a result. We are certainly bullish about the future for digital health in Nigeria. We know it's early days, but we know that it will make a huge difference. And we are creating the ecosystem to help people that are working in the area, particularly startups, succeed. So you can check us out online on digitalhealth.com.ng, follow us on Twitter, or send us an email. I'll certainly be on the HCP space, and I encourage you to sign up, log on, and connect with me. Thank you very much, and I wish you all the best as you enjoy the rest of your day. Thank you.